Chronic pain affects people of all ages. There's a saying that we could all be one accident, one surgery, or one medical procedure away from becoming a chronic pain patient for life. The chances of that happening increase with each and every day that we live. When I think about what groups of people are most likely to be affected, I think of the senior citizens, veterans, and people who are disabled. According to the nationalacademies.org website, chronic pain affects about 100 million adults in the U.S. That's more than the total number of people affected by heart disease, cancer, and diabetes combined. According to the MedlinePlus.gov website, research has shown that 50% of older adults who live on their own and 75 to 85% of the elderly living in care facilities suffer from chronic pain. But pain among older adults is largely undertreated. Untreated and undertreated chronic pain can leave patients with serious health consequences, such as depression, anxiety, decreased mobility, social isolation, poor sleep, and other related health risks. Dr. Carolyn Clancy provided testimony for the U.S. Senate about chronic pain within the VA system, citing that almost 60% of returning veterans from the Middle East and more than 50% of older veterans in the VA healthcare system are living with some form of chronic pain. Pain is often left untreated or undertreated due to concerns about addiction. According to the National Institute of Health's website, the risk of addiction is actually very, very low, and especially so among those with no history of substance abuse or addiction. Florida has become known for being a retirement hotspot for seniors and for having a serious opioid problem. On the CDC website, they have maps broken down by county showing the opioid prescription rates for each year. I wanted to be able to compare those statistics by year, but I wasn't able to find it in that format. So I created a spreadsheet broken down by county and by year. Then I went into each year and sorted it from largest to smallest. I wasn't sure how well the numbers would show up on this video, so I highlighted the highest 20 in green and the lowest 20 in yellow. Over on the far right, I added 2 more columns to show the population statistics for Florida's senior citizens and for Florida veterans. I tried to find statistics that showed the disabled population, but I couldn't find them broken down in the way that I needed them. I sorted and highlighted the senior population statistics and the veterans population statistics the same way that I did the prescription rates. I'm going to go into 2006 and sort the prescription rates from largest to smallest. If you look at the columns off to the right, you'll see that quite often the same counties are among the highest prescribing counties for each year after that. Now I want to look at the population statistics. It's hard to find the most current statistics, so the years are a little bit different. The most recent senior population statistics I could find are from 2015, and at that time, Florida had the highest percentage of senior citizens in the entire country. And in 2013, Florida was ranked 3rd highest in the nation for veterans population. When I sort this spreadsheet by elderly population from largest to smallest, Watch the left side of the screen. Almost all of that green disappears. And the same is true when it's sorted by veterans population, from largest to smallest. I think that's really disturbing, and especially when you consider that 50% of older adults who live on their own and 75 to 85% of the elderly in care facilities suffer from chronic pain. That, along with the fact that almost 60% of veterans returning from the Middle East suffer from chronic pain, and 50% of older veterans in the VA healthcare system do too. I think it's surprising to see that the counties with the highest senior and veterans populations are among those with the lowest prescription rates. On another spreadsheet, I wanted to compare the senior citizens and veterans population with the prescribing rates by state. The most recent statistics I could find for seniors, broken down by state, are from 2010. And these statistics are for senior citizens age 65 and over. The 5 states with the highest senior citizen population in 2010 were California, Florida, New York, Texas, and Pennsylvania. California, Florida, New York, and Texas are all among the 20 states with the lowest prescribing rates. And Pennsylvania just barely missed being within the 20 lowest prescribing states. The veterans population statistics are from 2014, and it looks like it's about the same. The states with the highest veterans population in 2014: California, Texas, Florida, Pennsylvania, and New York. And 4 of those 5 states are among the 20 lowest prescribing states in the entire country. They're the same states that came up when we were looking at the senior citizens population statistics. They're just in slightly different order. 2 different theories about this have been shared with me. One is that the senior citizens are drawing Social Security, and the veterans are getting benefits, and the people who are on disability are getting benefits. And the theory is that the government just hopes we'll all die and they can save all that money. If that is what they want, the process is being accelerated because a lot of the new laws have left so many doctors afraid to prescribe pain medication. Patients are being left with untreated pain or undertreated pain. Many are forced to live a sedentary lifestyle, and that leads to major health consequences. The other theory is that doctors are reluctant to prescribe pain medication to senior citizens because of the fall risk. But many chronic pain patients say they don't get high from these medications. When they first start taking them, sometimes they feel a little funny, but that quickly dissipates and there is no high. So you decide.